We have one last speech. It's the last keynote for today. It's Suzanne again, which I say again, but I'm just so honored that she spoke 3 times here. I asked her to do it. I think if you've been in any of her other talks, I've said that, she offered to do it. I said, you can do 2 of the same speeches, that I just want this one and I want this one, and then do 1 new one. And she made 3 new presentations for us. So she's amazing. And I just thank you. Suzanne, if you don't know, I feel like most of you do, but if you don't know her, she is an MD, an internist, and a nephrologist, kidney specialist. She's licensed here in the US, and she went on her journey, started her journey in a regular Western hospital, and came in contact with the flu vaccine and her patients having reactions to that vaccine, and started questioning, the policy of injecting them when they walked in the door sick, rather than initially she just asked for them to be vaccinated on the back end of their stay in hospital. And that took her down this road. She has an amazing book called Rising from the Dead. If you haven't read it, she'll be selling it afterwards. Here, as well as Dissolving Illusions. But Rising from the Dead is an autobiography of that story, of her going through that. And she went down the rabbit hole, as many of us have, and has just researched and researched and researched. And as I said before, one of the things I love about Suzanne is everything that comes out of her mouth has a PubMed ID, journal review article on the back end of it, so it's very hard to argue with her. Vitamin C is something that I've heard Suzanne talk about, I guess, personally, a lot, and different types of vitamin C, and what's good, and how much, and when should you take it, and all of this stuff that I said to her, when in this tract of building immunity, and being healthy as you can be when you're, in your life, so that when you do get sick, you're still healthy and you can fight it easily. And so I asked her to do a talk on vitamin C, and so we have vitamin C in pregnancy, and I'm so excited. This is the first time anyone's heard this talk, so I'm very excited, and thank you, Suzanne, for coming and being a rock star.
Okay, hello everyone. So, I decided to do this talk because I was getting a lot of emails from mothers or mothers-to-be saying, I read somewhere that I could get reverse scurvy, or my baby could get reverse scurvy, or what's the best dose to take, and when they were pregnant. And initially it just seemed like a silly idea. Reverse scurvy, what are they talking about? I'm sure that's not a real entity. Let me look around. So, I went to the Vitamin C Foundation. I went to some fairly well-known people who I won't mention. Actually, the most well-known people that I know, actually, in the vitamin C world, and asked them about it. And I just kind of got little answers like, no, it's not really a real phenomenon. Oh, if it is, and don't worry, you just taper. And I thought, but where is this idea coming from? It must be coming from somewhere. And I love that I have the luxury of following my inquisitiveness out, because I'm not seeing a patient every 15 minutes on a treadmill of insurance-based conventional medicine. So that's what I'm going to talk to you about today. And I'm not going to tell you what you should do when you're pregnant. I actually don't know what you should do when you're pregnant, but there is information out there. And I think the reason we haven't seen it is because it's actually really expensive to get this information. You have to purchase the articles. You have to first find them, which was not easy. And then once you find one article, you can look at the references and see what looks interesting and kind of follow things out that way when you're doing research. But regardless, it usually costs me between $11 and $35 for each article that I request, many of which I will never even use in my presentation. So that's probably part of why you don't hear more about this. But so this mom says to me, I'd like to ask your advice on what you believe is a safe amount of vitamin C during pregnancy. I've read that one mustn't take more than 85 milligrams per day during pregnancy due to risk of scurvy after birth and spontaneous abortion. That's the other one I've been hearing forever, the spontaneous abortion unicorn. And, it's based on some Russian study that I actually did order. There are a lot of studies I ordered in preparation for this that I haven't yet received. And I'm going to find a Russian to translate this. It's enough already. We've got to figure out what happened there so we can put that one to rest. So I say to this mom, where did you get this information? And she says, it was written on WebMD, American Pregnancy, and just about every medical source I could find online. I was checking with you to see if you're aware of any information, blah, blah, many thanks. So this is to you, Mom, wherever you are. Hopefully you'll see this video. And so reverse scurvy was the word I first heard, and I thought, well, that really doesn't make any sense to me, because reverse scurvy would be normal vitamin C levels, so I don't understand that. So then I found this term, rebound scurvy, in the medical dictionary, which is a vitamin C dependency state that occurs in the fetus of a woman taking megadoses of vitamin C during pregnancy, which triggers increased production of vitamin C metabolizing enzymes. And so those enzymes utilize the excess ascorbate that's available. When the supply is cut off suddenly, these enzymes are still grabbing whatever vitamin C is available, creating very low blood levels, leading to all the symptoms of rebound scurvy until they taper off or the vitamin C is resumed. So I thought, well, okay, that's simple enough. So if you're taking megadoses, you should just taper instead of cold turkeying. And then I thought, well, what happens when you have a baby? And what happens to that baby? And what about those babies' levels? And so I searched as far as wide as I could. And let's start here with the WebMD article that this lady was referring to. And sure enough, every other medical article is pretty much parroting this particular research here. And it says that some researchers believe that abruptly ending high-dose vitamin C supplementation can cause rebound scurvy. This is controversial, but it is probably wise to reduce high doses gradually. I agree with that, actually. So what about this one? This is a human study published in 1984 in Medical Hypotheses, and it was done on 2 adult healthy females that were given 10 grams, 10,000 milligrams orally of ascorbate per day for 2 weeks and 6 weeks, respectively. And then they stopped them both abruptly and put them on a maintenance dose of 150 milligrams. And then they looked at their urine excretion rate. And what you can see here is, so this is where they abruptly stopped. So this was subject 1 after 2 weeks of 10-gram dosing. Stopping abruptly, the levels drop. And so this is kind of the normal baseline range. And sure enough, she did drop for about 5 or 6 days below that baseline range in the urine. Okay, this is only in the urine. And the other one, after 6-week dosing, drops, and then she kind of drops a little bit below what the previous average baseline was as well, and then she came back up again, still on that 150 milligrams. So I think it would have been a better experiment if they had measured blood levels at the same time and some metabolites, but they didn't. But I think that this does show that it is probably a phenomenon in some people after taking high doses and abruptly stopping. Now the question is, would you ever call this scurvy? I would not call this scurvy. I don't think it's scurvy, but it's definitely a rebound phenomenon that happens, and it probably is because of the increased catabolism, and they've actually shown that in some other studies that I'll get to. This one here from 1988. This author, you know, there are a couple of dentists out there that wrote about some of their patients that were drinking lots and lots of orange juice and then abruptly stopped and came in with what they were able to measure, you know, gum scurvy. And there's really not a lot of description of what happened there, and I have a feeling that there's more to the story there. So I can't really say, but anyway, this was a letter in the American Journal of Clinical Nutrition, and it was related to humans that got 60 milligrams per day versus 600 milligrams per day. And then they followed the dynamics of the serum levels dropping after stopping the ingestion. And I'll say the 600 milligram dose did lead to a faster decline in the curve than the 60 milligram dose. But again, I don't think that necessarily says that there was increased catabolism, but certainly there was a more rapid drop in the person in their blood level after they stopped the higher dose. And I would have shown you charts from it, but the way they did the analysis was so weird that if I was a Cochrane database analyzer, I would have put this to like low or medium quality research. And this says that the effects of systemic conditioning in humans after large doses of ascorbic acid, similar to what was found in the recent study, may not be of common occurrence in all humans, but some individuals may be more liable to this effect than others under certain circumstances. Consequently, we stand by our original conclusion that individuals who have been taking a large amount of ascorbic acid should revert to smaller intakes gradually rather than making an abrupt change. And I still, you know, the more I read, the more I think probably just if you really want to be on the safe side, don't take 10 grams a day for months on end and then all of a sudden stop. Probably not a good idea. This study here was on pregnant guinea pigs that were given 300 milligrams per day, which is approximately equal in weight to a 1,500 dose in a human. And it was given during 30 days of their pregnancy, and I think that's about how long they're pregnant for. So these authors decided to look at that because there was a story or a write-up somewhere, which I haven't yet located, about 2 infants that developed scurvy in spite of an adequate daily intake of vitamin C and whose mothers had received large supplements during their pregnancy. So this is the one that looked at the metabolism of the ascorbic acid. And what they found was that offspring from mothers receiving high levels of ascorbic acid during pregnancy developed scurvy 4 days sooner than the pups from the dams, that's the mothers, receiving standard levels of this vitamin. The carbon dioxide excretion study indicated higher catabolism in the pups from the high-dose mothers. So I think we're having, increasing evidence that this probably really does happen in mammals. Then this author did 2 different studies. This is the other one. And so the long and the short of this one is that the mothers were fed a medium and a higher ascorbate diet while they were pregnant. And then the pups were born and they fed them either lower or higher dose diets. And they found that the catabolism, or, the breakdown of the ascorbate normalized at day 20 for the lower diet in the pups once they were born, measured by radioactive carbon monitoring. And they said that the enzyme systems responsible for degrading ascorbic acid are inducible during the fetal and neonatal period. So here we have an experimental study here. And the longer the high intake was kept up, the higher that high catabolism persisted. And that's pretty logical. I don't know how to translate this into humans. Then here we have, this is kind of a classic. Levine is one of the more mainstream writers on vitamin C from the Journal of the American Medical Association. And he says this, that harmful effects have been mistakenly attributed to vitamin C, including hypoglycemia, rebound scurvy, infertility, mutagenesis, and destruction from B12. Health professionals should recognize that vitamin C does not produce these effects. But see, I'm not going to jump really quickly on board with this, even though it was in a conventional medical journal by someone who's got a lot of knowledge about vitamin C, because I think it is possible under some circumstances that it could happen. So why would we want mothers to take vitamin C while they're pregnant at all? There are theoretical benefits to those mothers. Vitamin C does a lot of things in the body. It's more than just a vitamin. You can't build collagen with it. Cell division doesn't happen properly. Many enzymes don't work without it. Brain doesn't work. You can't metabolize fat without it. And you need it in order to make a fetus. And that fetus will rob it from the mother, even if the mother ends up having scurvy. So the mother definitely needs a certain level of vitamin C. And so if that baby, if the mother doesn't have enough to give, then there can be very bad effects upon the mother and the baby, actually. So there are benefits to the mother for the skin, for the liver, the placenta, the tendons and ligaments, which we know undergo huge changes during pregnancy, the perineum, the labor, and in postpartum hemorrhage. And these are all, I'd say, theoretical, but they were shown by Dr. Frederick Klenner's series of pregnant women that I'll get to near the end. So the vitamin C levels between a mother and the fetus are really interesting, because you'll find the placenta, after the baby's born, has about 2 times the amount of ascorbate than the mother has in her system. And the cord blood will have 2 times as much. And the baby will have 2 times as much. And the amniotic fluid will have 3 times what the mother has. And remember, the baby's bathing in that amniotic fluid, swallowing it. So it's really important that the infant gets enough vitamin C. And the infant is absolutely prioritized in that distribution. So ascorbate levels actually drop during fetal life. So the fetus needs the most when the implantation happens and when there's rapid growth. And towards the end, they seem to need slightly less. And that's kind of the curve of need. Delivery itself and labor also use enormous amounts of vitamin C compared to a C-section. The vitamin C levels after a vaginal delivery in maternal blood, amniotic fluid, and fetal plasma are about 20% of the vitamin C levels from a cesarean section delivery. Not exactly intuitive, but when you understand what a stressful event a normal birth is, you'll see, and I'll show you that as well in a minute. So the process of being born is a major but necessary source of stress for the mother and the infant. This is just recapping what I just showed you, that the amniotic fluid levels are much higher, and those are some of the references. If you want to take a screenshot of that and look for it, feel free. I'm going to go through some of these studies. Abruptio placenta halted at 1,000 milligrams per day. Clemetson wrote this. Clemetson, if you don't know, wrote a really thick, big, huge textbook just on vitamin C with all kinds of really interesting studies. Here we go. Let's look at the delivery, the stress of being born. And I show this in all my vitamin C talks because it's really important to understand this. These are the level of catecholamines, of stress hormones. There's the reference. You can find all my references on PubMed. There's the PMID number. This is an infant at birth. That's the amount of catecholamines that are in that baby. This is somebody who has a tumor on the adrenal gland that can kill you from high blood pressure or high heart rate, called a pheochromocytoma. Very stressful. This is a man during vigorous exercise. This is the woman during delivery. So that baby is having enormous levels of stress, oxidative stress, during birth. It's actually part of the plan. It's not an accident. It's not a deficit. It's not a problem, but it does need to be known about because there's also mechanisms built into, the mother's response and the breast milk and the stem cells in that placenta to dampen that all down once the time is right. So the catecholamines have vital functions. They create a window of alertness, which helps the bonding with the mother after the birth. It clears the lungs of that baby, dilates the bronchi. Think of what happens when your catecholamines are high. You get really dry mouth, right? Well, this is a time when you want those mucous membranes to dry out because those lungs have to inflate, open up, and you don't want excess liquid in there. It increases the glucose level and fuel mobilization, and it helps deal with that low oxygen level initially. So this is one of the few times in life where catecholamines are well tolerated, and they're very, very necessary. But after the birth, the mother immediately forms beta endorphins and other contents in her milk that are anti-inflammatory. And the blood from the cord and placenta has stem cells, which are also anti-inflammatory. So, how is it beneficial to the infant? Well, by vitamin C I'm talking about, beneficial to the infant. Not just during development, but actually at birth. So we're told that this is normal for 60 to 70%, the medical literature, midwives won't say this, but 60 to 70% of babies are supposed to have jaundice. And people think that that's normal. So no problem, we just put you under the blue light and stress the baby out and everything will be fine. Just get rid of that yellow color. It's not serving any purpose. So the medical literature actually shows that bilirubin has a protective function by mopping up free radicals that are created at birth. So again, I think it's plan B. There's plan A, B, C, D, probably up to F in order to keep that baby alive. So this was another study that goes along with this theory that I have. And so there are numerous ways for a newborn to get antioxidants it needs after birth. And the bilirubin is just one of them. But what they did here in this study is they looked at the antioxidant vitamins and hyperbilirubinemia in neonates. And what they found is that over here, these are the neonates with hyperbilirubinemia. They had lower vitamin C levels. Neonates without hyperbilirubinemia had higher vitamin C levels. And you can see the differences in the bilirubin. So there's definitely some correlation there. It seems to be fairly consistent. And so now the question is, well, if you gave vitamin C to pregnant women, could you prevent this jaundice, this hyperbilirubinemia? Well, this Italian researcher in 1957, so there's so much great research from the 1950s that we just don't have access to. You're going to pay an arm and a leg. But this one, I think, is really necessary to understand. So this doctor looked at 89 pregnant women during the started them in the study, 89 women during the first trimester of their pregnancy. They were entered into the study. And he gave them 1,000 milligrams of vitamin C orally every other day over 6 months. And then looked at the amount of jaundice. And you can see here that there was absent jaundice in 61% of them, mild jaundice in 24%, moderate in 3%. So that's really different than, well, we're expecting 60 to 70% of babies to have jaundice. Now, was it just because Italians eat better diets? I don't know. But I think that this is definitely something that really should be looked into farther. And there's certainly some evidence that having this antioxidant level in the baby could help prevent jaundice. So what do doctors do when there's jaundice? Is they tell you to put them under the blue light or take them out into the sun. And I actually don't believe that's the way to treat jaundice. And I did extensive research on this back when I was making my talk in 2015. And again, there's just so much that's counter to what we're told, and that you can have lower levels of hyperbilirubinemia and have trouble with encephalopathy, and that's really the concern. And you can have higher levels and be perfectly fine. So it's not just one factor that can cause this problem in the brain. And there are other ways to deal with it. So really the way to deal with it is put that baby on the breast and have it drink as much as you can possibly get it to drink. That's the best way to deal with hyperbilirubinemia. Having the mother sufficient in antioxidants that she can actually also give through her breast milk. But when you put them, this study here showed that when you put them under the blue light, you're actually lowering their vitamin C levels. You're destroying antioxidants. You're destroying glutathione. And you're lowering their albumin. That's really not a very big favor. So then this study here looked at an important question, which is just the average person on the street that's maybe taking their relative in and out of the hospital, not a hospital patient. Do they have adequate levels of vitamin C? So this Canadian study looked at what they were considering a normal reference group. And they just measured their blood vitamin C levels. And they found that what they consider normal, which I think is not normal, it's too low, but they considered a level of greater than 28.4 micromoles per liter normal. I think probably closer to, 100, 150 is possible to have most of the time. But they considered this normal, and they said that 84% of them were normal, and that 13% were subnormal, and 3% were outright deficient. And then they decided to look at inpatients once they went into the hospital. And the picture wasn't quite so pretty at all. And they found that there were 60% that were considered subnormal, 19% were deficient, and 21% were considered normal. So nearly 1 in 5 had a plasma vitamin C concentration compatible with scurvy, according to the medical system, when they went into the hospital. And guess what doctors do immediately? They stop all supplements once you get into the hospital. And by the time you leave, you can be assured that your vitamin C levels will be lower, unless you sneak some vitamin C in a McDonald's cup, because nobody will look twice if you bring McDonald's food into the hospital. So this review here, Cochrane, I feel sorry for Cochrane people because they have a really hard job to do. I mean, you should see the amount of studies. This is like over 100 pages, this paper. And they looked at tons and tons of different research to try to come up with some conclusions, try to group them into good, poor, medium quality studies. And I'm just going to kind of cherry pick here a little bit just to keep the pro-vaxxers happy so they can say that I cherry pick. And so they came back with their general consensus that the data do not support routine vitamin C supplementation alone or in combination with other supplements for the prevention of fetal or neonatal death, poor fetal growth, preterm birth, or preeclampsia. Now remember, they're measuring this mostly in American well-nourished women, okay? So I really don't think you can say that about people who have nutrient deficiencies. There was no convincing evidence that vitamin C supplementation alone or in combination with other supplements results in important benefits or harms, okay? But there was a 36% relative reduction in the placenta coming away early from the uterine wall in women giving vitamin C supplements. So there's a benefit to keeping the placenta intact with the vitamin C supplementation. And it was rated as high quality evidence. So they're real sticklers for their, the amount of evidence and grading it. And I'm not. I can't tell you what I'm showing you graded as far as what's high or low quality. So in the studies that gave women vitamin C only, there was a reduction in pre-labor rupture of the membranes occurring either preterm or at term. Yeah. So that's what the Cochrane says. I think it's a really difficult job to take. I just thought you should know that this exists, not that I'm actually taking this as Bible or anything like that. Vitamin C and outcome of pregnancy was looked at by Vobecki in 1974, 1,500 humans. It was an outpatient clinic. They were middle-class women. They looked at the blood vitamin C levels various times during pregnancy, and they compared the levels of those with complications to those with normal pregnancies. And what they found, that the mean values of plasma vitamin C were compared in uneventful pregnancies with those ending in abortion, stillbirth, or congenitally malformed newborns. And you can see over here that what we're looking at here is normal pregnancies, complicated pregnancies, and the proportion of women with plasma vitamin C level below 0.5, and that's pretty much considered deficient, okay? So in the first trimester, if there was low vitamin C level, you can see that there were less of those people falling into that group having a normal pregnancy than having an abnormal pregnancy. So in other words, the higher vitamin C levels led to more, or were consistent with more normal pregnancies. And that makes sense because, as I told you before, that's really the time when you need to have more of the ascorbate present. But you can see it was also true in the second trimester. The third trimester, the results were approximately equivalent. And these results are not considered that different, but when I looked closely at this chart, I could see that the malformed fetuses had lower vitamin C levels than the matched controls, 0.48 versus 0.67. So there's something there that I think we need to consider. Poor vitamin C status in late pregnancy, another study from 2017, is associated with increased risk of complications in type 1 diabetic women. Now, you should know that that diabetes, alcoholism, and smoking are, in my opinion, absolute reasons to go above the FDA recommendations and even above what an average person would need. Ascorbate is needed for pretty much every aspect of glucose handling, insulin release, and insulin production. So you're only going to benefit as someone with diabetes by either having a high vitamin C intake or supplementing with some ascorbate. But they looked at these women during pregnancy. And there were 47 women, and they looked at their vitamin C status late in the pregnancy. They looked at the fetal outcome, complications, diabetic characteristics, and glycemic control. And they found that 19 out of 47 had complications, and they had a level of 24.2. 28 didn't have complications, and their levels were certainly higher at 34.6. Hemoglobin A1C showed an inverse correlation with vitamin C, so higher vitamin C's, lower hemoglobin A1C. That means that there's better glucose control. So their quote was there that hypovitaminosis C in late pregnancy may be associated with an increased risk of developing complications in pregnancy and may also to some extent limit the obtainable level of vitamin C of the fetus. Okay, so we're getting the picture now, right? This was an article from Uganda from 2011, and they looked at 207 cases of preeclampsia versus 352 controls. And they looked at their blood vitamin C concentrations. And here's what they found. The first table here shows that more preeclampsia women had lower vitamin C levels. So here we have preeclampsia. This level here is pretty much consistent with scurvy. So this was low, medium, and more acceptable levels of vitamin C. And you can see here the preeclampsia, there were 18.8% versus normal pregnancies of 9.7. So definitely the low vitamin C levels seem to have increased the risk. The odds ratio was 2.34, meaning that there's about a 2.3 times higher rate of having complication if your levels were in the scurvy range in this Ugandan hospital. Pretty amazing that it's even, that good, I think. Then the second table shows that after controlling for confounders, women who had low vitamin C concentrations were 2.9 times more likely to develop preeclampsia compared to women with normal or high plasma levels. And they concluded in preeclampsia there is a relative reduction of antioxidants and the plasma levels of vitamin C are reduced. So, I think about this in terms of nutrition, really, because I happen to know a little bit about how glucose is handled and how it's metabolized and how oxidative stress occurs and free radical formation. And I kind of lurk on these ketogenic Facebook sites and talk to people who have done ketogenic diets, both vegan and meat-based and mixed. And they have less inflammation. So people that have higher protein and fat diets tend to have less inflammation. People who have a lot higher carbs and less high-quality protein and fat tend to have more inflammation. And so I think there's got to be something here as well in a Ugandan place that we have to consider, but that wasn't actually calculated in here. So, I think that your vitamin C need is actually far less when you're eating fewer carbs. I'll just add that. So here's another research study where vitamin C supplementation during pregnancy reduces hospitalization and outcomes in a Ugandan rural cohort study. They looked at 384 pregnant women that met the inclusion criteria. They were randomly assigned to get 200 milligrams twice daily of L-ascorbate or nothing, and all other prenatal vitamins were the same in both groups. So they looked again at the hospital admissions and at other parameters. And they found, so this is your non-hospitalized vitamin C level control, the vitamin C, the ones that were dosed with vitamin C. And you can see that 42.2% of women in the vitamin C supplement group and 27.9% in the control group were not hospitalized during pregnancy. And they found that difference to be statistically significant. And down at the bottom, the low birth weight was found in 15.5% of women on the vitamin C group versus 23.8% among the control group. So less low birth weight in the supplemented group, fewer hospitalizations in the vitamin C supplemented group. This is a letter that I found in the Lancet talking about vitamin C and fertility. And they talk about that from the time of the release of the ovum, during fertilization and the first 3 months of pregnancy, and during the later stage of pregnancy, excessive demands are made by the mother and developing fetus for supplementary vitamin C. There was no evidence that a daily dose of up to 2,000 milligrams produces side effects. Our evidence shows that a dose of at least 1,000 milligrams is necessary in women to maintain normal tissue levels of ascorbic acid and consequent tissue repair and replacement during the common cold. Down at the bottom, it's reasonable to infer that at least 500 milligrams of supplementary vitamin C is required daily as a maintenance dose in the pregnant woman in order to prevent tissue depletion of ascorbic acid and maintain optimal tissue growth of maternal and fetal tissue. So that's just a letter. It was based on some studies that I've ordered and have not yet received. I'm almost done with the studies, and then we'll get into more dosing and what's the difference between natural and synthetic ascorbate and Klenner. So this was a short communication in Toxicology and Applied Pharmacology, 1976, effect of a large daily dose of ascorbic acid on pregnancy in guinea pigs, rats, and hamsters. And they said the present investigation, together with that of others, revealed no adverse effects of large daily doses, 400 milligrams per kilogram per day, of ascorbic acid on pregnancy in 4 different animal species. They used guinea pigs, rats, hamsters, and mice. And they found no effects with oral doses, no adverse effects, of 50 to 450 milligrams per kilogram per day. That's a good dose. Our results are in agreement with others who reported, while this investigation was in progress, that ascorbic acid had no effects on pregnancy in rats given higher doses, 150 to 1,000 milligrams per kilogram today, none in the 250 to 1,000 milligrams per kilogram today. Thus, the present investigation, together with Froberg, revealed no adverse effects of a large daily dose of ascorbic acid on pregnancy or the offspring in those 4 animal species. No talk about rebound or anything like that. This was another little study on pregnancy and tissue carbohydrate levels by vitamin C in rats on restricted diets. So this was a necessity study, really. And it looked at rats on calorie-restricted diets versus ad lib. They could eat as much as they wanted, and then they threw the vitamin C in it to the restricted rats. And now remember that rats can synthesize their own vitamin C, so they're not dependent upon it like guinea pigs. And that's one of the reasons that guinea pigs are used, is because, like us, they're dependent on their dietary source. So this is kind of a breakdown. There were 24 rats that were fed as much as they wanted to eat at all. They were not given any extra vitamin C. And then there were 37 rats that were put on a calorie-restricted diet, which was what a non-pregnant rat would have eaten. So they weren't starved, but they were restricted. And 15 of those rats were given 25 milligrams per kilogram per day of ascorbate in a subcutaneous injection. And what they concluded is that the diet restriction adversely affected the maintenance of pregnancy, but when vitamin C therapy was given, more pregnancies were maintained. Vitamin C in pregnancy appears to play an important role in regulating carbohydrate metabolism in the liver, the uterus, and the blood. So I would say that this really would pertain to women who have a lot of morning sickness and are unable to keep their caloric intake high. If nothing else, they should be trying to get some supplementation on vitamin C, because this is showing that, their chances of having a normal developing fetus and a normal pregnancy are going to be higher, even if they're on that restricted diet. So this fellow here is named Dr. Frederick Klenner, and anyone who's ever studied vitamin C would have run into him. He was very outspoken in the 1950s during the polio vaccination campaign. He was treating paralytic poliomyelitis with very large intravenous doses of ascorbate and having success, he claimed, in 100% of his patients. And he also was very active in vitamin C, both orally in high doses and intravenously in times of pregnancy. So he looked at over 300 consecutive obstetrical cases using high doses of vitamin C, and he said, using supplemented ascorbic acid by mouth convinced me that failure to use this agent in sufficient amounts in pregnancy borders on malpractice. So Frederick Klenner didn't mince any words, and you'll know that if you read his report on the polio trials. He's a very brilliant man. So what he did with his patients, and a lot of pregnant women that I know do exactly this, and he would give 4,000 milligrams each day during the first trimester, the first 3 months of pregnancy. He would give 6,000 milligrams each day during the second trimester. And of course, not all at once. It would be divided probably in 3 doses. 8,000 to 10,000 milligrams a day during the third trimester. And he said some women got a 15,000 milligram daily during the third trimester, and he would give a booster injection intravenously of 10,000 milligrams to 80% of the women upon admission to the hospital for childbirth. The results were no miscarriages in this group of 300. Now, there's no mention of rebound, but knowing Frederick Klenner, he still had those mothers on vitamin C after delivery. He wouldn't have said, oh, just stop, you don't need it anymore. So I think that rebound was probably not an issue in his patients. He reported that hemoglobin levels were easier to maintain in these ascorbate-treated women. Leg cramps were less than 3% and always associated with getting out or running out of vitamin C tablets. Striae gravidarum, which are stretch marks, was seldom encountered, and when it was present, there existed an associated problem of too much eating and too little walking. He probably told them that too. Labor was shorter and less painful. And, intravenous vitamin C is actually used in people that are withdrawing from opiates. So there's definitely some pain mechanism that's dealt with there. There were no postpartum hemorrhages. The perineum was found to be remarkably elastic. And he went into great detail on that, which I'm not going to share with you. But this article is available in total online. I think at Whale, too, you can get a lot of this stuff that I'm talking about. So human milk and vitamin C is another issue. I thought, well, let's take a look at that, because a lot of people call me and they say, the mother died or the mother can't make milk and we've got all these donors, but we have to refrigerate the milk, and should the mothers be taking supplements? Should I be taking supplements while I'm breastfeeding? What if I freeze the milk? So there are some answers out here regarding this. And I put together this slide a long time ago, and I have to admit that I can't find a reference for the one thing I said, and I think it's because it was in another language. But so far, we know that mothers with acceptable levels of vitamin C produce milk with 8 times more vitamin C than their blood, and that was from Ahmed in 2004. I'll show you that in a minute. People who supplement have 15 milligrams per liter. Human milk contains... see if I can break this down for you, 7.5 to 8.2 milligrams per deciliter when the mother's serum is 0.19 to 1.77. So what I want you to notice is that the mother's serum is always lower than what the milk contains. So lactating tissue is excretory, and it's going to concentrate and give preference to the baby over the mother, just like in utero. The highest milk concentration I could find in the literature was 157 milligrams per liter, and I can't remember if that mother was supplementing. There's something in the back of my head says she was. 80 to 100 milligrams per day orally by the mother is needed to get milk around 49 to 59 on average. That's say she's not a smoker, because each cigarette uses about 25 milligrams of vitamin C. And I don't know about IV doses. I would love to have somebody sponsor a study where we give intravenous doses or real high oral doses and check the milk levels and see what's going on, comparing it to the blood levels, because it may be that there's a cutoff point where the mother can get her level up super high and that breast tissue isn't going to continue going up. I really honestly don't know. So this was a study that I just mentioned to you by Ahmed, and what I want to draw your attention to is the difference between the mother's levels and the breast milk level. I mean, look at that drastic difference. So this was in Bangladeshi mothers, and they were considered well-nourished by BMI, but probably they weren't so well-nourished. But definitely the baby and the milk take priority when distributing the vitamin C in a body. And this one, it just pertains to, well, what happens if I take the milk out? What if I pump? Well, it turns out that the vitamin C levels drop pretty quickly, and you can see that around 20 minutes, you're going to go from an average of 41 milligrams per liter down to anywhere between 0.77 and 38. So the vitamin C can degrade pretty rapidly when when the oxygen is interfacing with it. So what about synthetic ascorbate? I hear all the time, and I'll tell you, when I first started looking into this and exploring all the vaccine controversy, people that I really respected said, stay away from that synthetic ascorbate. It's garbage. It's made by Hoffman-LaRoche. It's going to rob your body of valuable nutrients. Throw it in the garbage bin, and I did. And then I started trying to take Camus and rose hips, and it's not only expensive but pretty vile tasting. And then I continued researching, and I'm back now to the cheap Hoffman-LaRoche sodium ascorbate because I think there's evidence that it is of value. So let's take a look at that. I'm often told that Sven Georgi, who was the fellow that first discovered the ascorbate molecule in the adrenal glands of animals, couldn't cure scurvy in a friend of his who was having thrombotic bleeding. And then he gave him a paprika, and he was cured. And I thought, okay, well, maybe that happened. I honestly don't know, but I'm not going to hang my hat on that. Let's see what else is going on. And then I looked further, and I find this very same doctor did a study where they were looking at the difference between lemon juice versus the hexuronic acid, which is basically L-ascorbate that was isolated from the adrenal glands. And they did give a slightly higher dose of the adrenal gland extract than the lemon juice. And the results after 56 days, these were on guinea pigs, I believe, is that when they slaughtered the guinea pigs, they found that there was no scurvy in the ones that got the extract from the adrenal gland. Now, mind you, what you isolate out of an adrenal gland of any animal is not natural whole bioflavonoid vitamin C. It's L-ascorbate. So that's the equivalent of what Hoffman-LaRoche is making. It's just that Hoffman-LaRoche makes it in the machine, and this animal synthesized it in their liver out of sugar. So the lemon juice animals had mild scurvy, and the controls that didn't get vitamin C died and had scurvy after 26 days. So this was the 56-day experiment, and if you don't believe me, I took a little snapshot just so you could see that I wasn't making it up. And there's the reference that you can pay $35 and get if you'd like. And then they followed them out to 90 days and reported on that, and pretty much the same thing happened, is that the lemon juice ones survived. They had slightly more scurvy than the animals that had L-ascorbate synthetic. It would have been interesting if they gave them similar milligram per milligram, but they didn't. But to me, this is just basically saying that the L-ascorbate that was isolated from the adrenal glands, but was not plant-based vitamin C, did prevent scurvy in these animals. So when people, want to argue that vitamin C, that L-ascorbate doesn't cure scurvy, I say fine, eat all the plants, all the bioflavonoids, always, always, always do that. I'm not trying to keep anybody away from blueberries, blackberries, parsley, kiwi fruits, red peppers. We should always consume enormous amounts of those unless you're, a ketogenic meat eater, in which case you're not going to need quite as much, and you'll hopefully be eating organs, which will also have some vitamin C in it. But there have been lots of doctors who have only used injectable synthetic L-ascorbate and have had remarkable results. And Fred Klenner's one of them. Linus Pauling took pretty big, I think 10 grams a day of oral ascorbate. And Archie Kalokerinos from the Australian outback would inject 100 milligrams intramuscularly into kids that, would normally have had SIDS. He had 1 and 2 deaths after the nutrition changed because of the government food supply and the vaccines came in. And he said, I pretty much performed a miracle here just by giving 100 milligrams of vitamin C. He started having pinches of ascorbate put in the infant formula that these Aboriginals were told they needed to use. And he said there were no more SIDS after that. So to me, there's more proof that L-ascorbate definitely prevents scurvy, SIDS. Robert Cathcart is another one who reports using up to 300,000 milligrams in a single dose in humans, finding no problems with it, and reversing and ameliorating lots of significant disease. There are hundreds of doctors and practitioners who are reversing disease with artificial vitamin C. I'm one of them. I find that in my own life and in my family and my patients, that the use of ascorbate is definitely something to have on hand. There are now lots of infants that are growing up all around the world having read the simple protocol that I wrote on treating whooping cough with artificial vitamin C. Those babies are all living and they survived at home without huge amounts of drama, without any drugs, without antibiotics. As far back as 1936, there were doctors describing scurvy cases that didn't respond to food but only to intramuscular ascorbate. I don't really know what that case was because I have been unable to locate it. I found that as a reference. But this one here I do have. These guinea pigs were kept alive for 1 year on a flavonoid-free diet with 20 milligrams of synthetic ascorbate per day. So we don't actually need those flavonoids. We probably should have them. I'm good. I'll be done in 10 minutes. So most pregnant women in the USA don't have scurvy, and that's really the point. So we're not really necessarily trying to prevent scurvy in this country, but I still think that there's probably a place for using at least lower dose, maybe 1,000 to 2,000 milligrams of ascorbate per day, although I think that, people need to do their own research. Don't just believe me. Don't just believe anybody. The flavonoids are the part of the vitamin C molecule that pretty much preserves it in the fruits and the vegetables. Okay, so that's why it's needed in nature. And once you cut into a fruit or vegetable, the level will drop of the L-ascorbate pretty quickly. The flavonoids also will chelate out in the copper and minerals in water, and so any kind of toxins that could be coming through there. So they pretty much act as preservatives for those plants. So here we have, I just want to freely admit that whole vitamin C from plants is not the same thing as L-ascorbate. I'm not trying to argue that it's the same thing. I'm just saying that both of them are therapeutic. But if you've got a kid with whooping cough, good luck trying to treat them with parsley and red peppers. You're not going to be able to treat them, especially if they're little teeny babies. And I've just had so much success with using the L-ascorbate. My website has the document for free that you can download on the vitamin C treatment of whooping cough. So, you're pretty much paying for both of these, one way or the other. And if you're paying for the Camus or rose hips or acerola, you're paying a lot more than you're going to pay for the L-ascorbate. And you are also often, if you look at the fine print on the label, there's sucralose. There's artificial sugars in those because they're so tart that they've got to sweeten them somehow. So make sure that you're at least getting something sweetened with stevia if you're going to buy those natural ones. They're far more expensive. They're about 10% by weight as potent. I think they're perfectly fine for daily use. Go for it. I'm not trying to discourage you from using them. You're not going to cure whooping cough in babies with it, even if you can get them to take it. You can't administer this intravenously. Whereas the synthetic ascorbate, I usually recommend, I'll show you what I recommend in a minute, but you can get this from animal glands. There were sailors that were going across the ocean that were normally dying of scurvy back in those days of Captain Cook. And the sailors that ate bear meat actually survived, and the ones that didn't died. So there's definitely C in some of the meat and definitely in the glandular tissue. But mostly we're talking store-bought. It's the active part. It's inexpensive. It's very potent for whooping cough. You could administer through virtually any route, and it will cure scurvy. It will prevent problems. So I just made this up back when I was getting into the whole vitamin C, just to show you that it's not exactly what you think, that oranges are the greatest way to get whole vitamin C. They're not. Really, the greatest way is, I think, the red pepper, the kiwi fruit, 140 milligrams for 2. That's a pretty enormous amount in food. So you could easily get 500 to 1,000 milligrams a day just eating food, and that's what we should be doing. The animal in the wild and generally will need about 30 milligrams per kilogram per day. That's my guesstimate of what the average healthy human should have. 30 milligrams per kilogram per day of some sort of ascorbate, not necessarily whole. So these are, I mentioned this already. So these are the synthetic brands that I keep on hand, except I don't keep this on hand because it gives me a headache. But I read Dr. Tom Levy's book, Primal Panacea, and in there he talked about if you're taking intravenous that you should also be taking oral dosing at the same time. And I agree with him because intravenous vitamin C will be out of your body in 4 to 6 hours. So everybody thinks, woo, I got intravenous treatment, that must be so much better. Well, it will give you super, super high levels for a really short amount of time. So it's fine if you want to boost your levels. But on an ongoing basis, you need every 4 hours if you want to keep steady levels, or at least a couple times a day if you're going to be supplementing with lower. So he recommends if you've got cancer or some terrible disease that you're treating intravenously to use all different kinds. And this is the fat permeable type. I find it gives me a terrible headache, and I just don't know why. So why bother? I don't need it. Other people do fine with it. There's no guarantee that it's going to be, get through the fat because it's a complicated process to make this. This I have on hand all the time, whether I'm traveling or whether I'm not. I'll actually snort this straight up my nose if I have a sinus problem. It burns a little tiny bit, just a little bit, not a big amount of it, just a little tiny bit will open up sinuses very quickly. It will deal with the equalization problem in airplanes, but it's got to be sodium ascorbate, not lemon flavored, not ascorbic acid, but this just plain old sodium ascorbate crystals. Every home should have this in stock. I like this brand. I don't receive any money for this, but I like it because it's a non-GMO source. This is one of my new favorites because it's so tasty that I've never seen anybody say yuck, no matter how old they are. And so if they don't like this is a great way. If you put 50% this and 50% this, you'll get any kid to take their vitamin C. So this is a lemon peach flavored. It's a little more expensive, although the distributor does give the general public a 25% discount if you buy in larger amounts, I think 6 or more jars. It's absolutely delicious. It's sweetened with stevia. It has some ALA in it and some green tea extract without caffeine. So it's just a nice little concoction that I just like the taste of. So instead of, grabbing some soda that's unhealthy, I'll grab this now if I want something with some flavor. And this is the liposomal. Again, I think every house should have this. It's useful topically. It's great to give babies when they're sick because you can just swab it into the mouth, just little bits at a time. And then this is the intravenous route, which, I think in special circumstances is great. But I find that people, when they do have needles in their office, they like to use them whether they're needed or not. And I pretty much can treat most of what I do with oral ascorbate. I don't really need IV or intramuscular. So I think, if we really had a good health system instead of a medical system or a sick system, there would be a few things that we'd be doing differently. We'd be investigating the ascorbate effects and levels in health, in pregnancy, and in all illnesses. We would be measuring ascorbate levels in human milk at varying blood levels and at oral and IV dosing. We would have readily available means to test the plasma and urine in hospitals and the urine at home at low cost. Do I have enough vitamin C in my body? I don't know. Let me see if I'm spilling any over in my urine or not. Things like that. And you can purchase these things online. They are available. I think that most patients, once they're, evaluated for certain things when they get into the hospital, they should be given ascorbate right away. You're gonna decrease the need for so many other things if you can get some ascorbate into most hospital patients. I showed you what the levels were by the time they arrived there. But for now, I recommend that we should use good judgment on dosing. Always start slow, see how things go. Don't just go running in there, like a bull in a china shop. You'll learn what your own tolerance is. Everybody has different tolerance. And figure it out, on a day when you don't have to go to work, you'll feel your belly gurgling, and see how much you can tolerate in a day. Some people can tolerate huge amounts. Other people can get diarrhea on 500 milligrams. So figure it out for yourself. Figure it out for your kids. Eat well always. Always consume lots of fruits, organic, low processed food. The amount of sugar you eat in your diet will actually compete with the ascorbate molecule on the cells. So your absorption and your usage will go down if you're having any sort of carb, even if it's a sweet potato or something that's healthy. So just know that. Avoid the potential for the rebound phantom by tapering following high dosing. And I'm actually starting to do that myself more, because when I'm now thinking back on certain events, I'm thinking, wow, I wonder if that's what happened. So I do think there is a reason it's reasonable to do that. So, I think if you're doing 6,000 to 10,000 milligrams a day and you want to slow down, then maybe go 2,000 and then 1,000 for a few days and see how things go. Always maintain hydration. And anybody who's getting high levels of ascorbate, unless they're in an intensive care unit, in which case we do have a study showing that on death's door, you still increase the survival rate, even in people with kidney shutdown and liver shutdown, by giving intravenous ascorbate at high doses. But if you're not on death's door, please hydrate first, because it's really important to protect the kidneys, to decrease the potential for precipitation of crystals and stone formation. Hydration first, then give the ascorbate. And I did have some other slides, but I really don't need to go through them. So we can end now on time.
Thank you, Dr. Suzanne. Can I ask about the effect of heat on the vitamin C? And because I've heard that maybe it will minimize.
About 110 degrees Fahrenheit seems to be when it breaks down. So if you want to put it, I do the same with like sauerkraut and things like. The other thing, if you don't know, if you're fermenting vegetables, a pot that has 30 milligrams per cup will go up to about 800 milligrams per cup after fermenting. So fermenting is a great way to turn that sugar in the food into ascorbate. And so I'll sometimes try to hide that in like kids' soups and things like that. But you want to let it cool down a bit so you're not going to destroy it. So I think it was 110 Fahrenheit, but check that out because I'm just going on memory, which is running ragged right now. But heat and oxygen touching it will destroy it.
Okay, so I'm curious, because I have that sodium ascorbate that you recommend. Do they process it at less than 110? I don't know how they dry it. Okay, I was just wondering how.
Probably not. They probably heat it. I'm sure they use some heat, but I honestly don't know.
It's still effective.
Yeah.
Okay.
I think on your second to last slide, you just mentioned that it was, or last slide, you're mentioning that we should limit sugars. But with eating a lot of fruits also have sugar content as well. So
They do.
if you eat a lot of fruits, aren't you also
So when I'm,
increasing sugars?
dealing with kids that are sick, I tell them that they can have, they can have as much whole fruit as they want, because, there's the whole ascorbate in there, and how much fruit can a kid actually eat. But smoothies and juicing and things like that, I think should be kept to it, because then you're really concentrating the sugar. Yeah. So, just use your good judgment when it comes to that. But you just have to know that the sugar will compete for the ascorbate, whether it's natural in the fruit or not.
Then is there a dosage in terms of how much sugar versus?
I don't know.
Yeah. Okay.
Yeah.
Thank you.
Are there any other good non-GMO sources besides that one?
Probably.
Okay, I didn't know if you knew.
You could probably find. I have seen others, but I can't tell you offhand.
Okay. And
But the reason I like this is because it's available worldwide, either on iHerb or Amazon.
Thank you. And quickly, when you said you were lurking on ketogenic diet sites, did you say high-fat diet and less protein?
No, high fat, high protein, low carb.
Meant less inflammation? Mm-hmm. So high-fat, high-protein, low carb.
There's one called zero carb that I've been kind of watching, talking to some people. These people come on and they show you their weight, they show you their horrible laboratory reports, their insulin requirements. And some people, after a year of doing this, they're down to a normal size, they're not requiring insulin, they're off their blood pressure drugs. There's definitely something to it. Now, I don't think it's a way to live for the rest of your life. I think probably they should transition to paleo after that. But I don't think that, there's definitely an effect. There's no doubt about it. Dr. Toni Bark does the vegan version, so you can talk to her if you want to go the vegetable way. Personally, intuitively, I would just do both if I wanted to be keto. And you don't have to limit, you can pretty much continue to eat. So there's less inflammation, which means less cortisol, which means less of all the bad things that are causing diseases.
I ate more fat this year in my diet without really thinking about it, the good fats, and lost weight. Mm-hmm. And what's the inflammation blood marker? Creatine? What is it? It was low. One data point.
Mm-hmm. Well, we've been lied to about fat, so just know that.
Well, you mentioned liposomal vitamin C usage on infants, but I'm curious about, there's more companies coming out with liposomal vitamin C orally. What's your take on that? Because vitamin C, it seems like a contrast to me because vitamin C is not fat soluble, it's water soluble. So
it is. So what it is, you've got this water soluble molecule in the middle and it's surrounded by fat. And so because of the dissolving light phenomenon, so you don't need the transporters in the intestines to bring it in. It can absorb through the mucous membranes. And so it's because it's surrounded by that fat layer. Now, as far as other brands, I have had people use other brands, flavored brands. I just don't feel that they work as well when you've got a really sick person. And so because I'm used to this, I use a lot of it. I still continue to recommend this, but I have nothing against other brands that are liposome. And some people that are allergic to soy, that is a downside. This is a soy-based liposomal product, so you might want to go for one that's sunflower oil based. They are out there.
So as far as absorbability or usability, is there any difference that you have seen in the liposomal versus?
Yeah, initially I thought there was, but I'm actually going to rewrite my article because initially I thought that people were requiring less of it when they were using the liposomal, but I don't. After a couple more years of really seeing hundreds of more cases, I don't think so. I think it's pretty much a milligram per milligram equivalence. Yeah. Okay, thanks.